Hello everyone, I am Dr. Nitesh Rustagi. I am a consultant orthopedic surgeon practicing in Delhi. Today we will be discussing about the ligament injuries of the knee joint. One of the most common ligaments to get injured in the knee is ACL or the anterior cruciate ligament. Before we begin, let's briefly discuss the anatomy of the knee joint. The knee joint is made up of two bones, the femur or the thigh bone and the tibia or the shin bone. The ends of the bone near the joint are covered by a smooth substance called as cartilage, which helps in easy gliding of the bones on each other. In between the two bones, there are two shock absorber like structures called as meniscus, which helps in equal distribution of the weight. There are four main ligaments in your knee. The MCL or the medial collateral ligament, which is present on the inner side of the knee joint. LCL or the lateral collateral ligament, present on the outer side of the knee joint. ACL or the anterior cruciate ligament, present in the front. PCL or the posterior cruciate ligament, present in the back. The most common mode of injury in an ACL is a sports related injury when you suddenly change directions or when you pivot, that is turn around on a plantigrade foot. Your ACL can also get injured in case of a trauma or a direct blow to the knee. The typical symptom of an ACL injury is you hear a pop inside your knee joint followed by pain and swelling. Your knee might feel heavy due to collection of blood which will restrict knee movements. Later on, you may have a feeling of instability in your knee joint, that is, you lose confidence in your knee. You may feel that your knee is going to give way, making you fall down. Now, what to do when you injure your ACL? Immediately take rest. You can put ice on the affected knee to take care of the swelling. You can wrap your knee with a compressive bandage and elevate your leg. Take some over-the-counter painkillers and then see your orthopedician at the earliest. When you reach your doctor's clinic, your doctor will ask you about the mechanism of injury and then he is going to examine your knee. In most of the cases, after history and examination, your doctor will make a diagnosis of ACL injury. To confirm his diagnosis and to rule out other associated injuries, he may order an X-ray or an MRI scan. ACL is one such ligament in the body that usually does not heal on its own. In very few cases, in a less number of patients who are not very demanding lifestyle wise, it can be treated with a program of physiotherapy and bracing. These patients can carry on their activities of daily living, routine activities, but it becomes difficult for them to take part in running, any sort of sports, hiking or trekking. In majority of patients who lead an active lifestyle, they will need to undergo an arthroscopic ACL ligament reconstruction surgery. It's a minimally invasive surgery with very small incisions in which we use special instruments called as arthroscope to reconstruct your ACL. You take tendon from the back of your thigh and then put it in the place of your original ACL through tunnels made in the femur and tibia. It is then fixed on the femur with a button and on the tibia with a special screw. After undergoing surgery, you will need to undergo a special physiotherapy program to regain the knee movements, the strength of your muscles and to regain your confidence back. Thank you.